Welcome to the second ever audio interview with optometrystudents.com and Dr. McGovern of Northport VA. Please comment on the article and we hope you enjoy.
Okay, this is Matthew Geller with optometrystudents.com, and today we have our second ever audio interview. We have a very special guest today, and it is Dr. McGovern from Northport VA on Long Island in New York. How's it going?
Good, Matt. I'm looking forward to this. I appreciate you inviting me.
Yeah, absolutely. Dr. McGovern came and spoke at SUNY, and he had a really interesting story to tell, so I figured we'd get him on and have him talk about his experiences. And he's an expert in the area of residencies, so today we'll center our interview around that. So I'll begin with the first question. So, tell us a little bit about yourself and, what optometry school do you graduate from, and if you did a residency and things like that.
Sure. Well, I graduated from SUNY Optometry in 1997. When I was finished with the program, I did a one-year residency at the Northport VA. The program was in basically hospital-based primary care optometry. And after I graduated from the one-year residency, I went back on staff at Northport. And then two of the doctors at Northport, Dr. Alan Cohn and Dr. Richard Soden, also had a private practice out in Lake Ronkonkoma on Long Island. So I also went to their practice part-time. So I was part-time at the VA and part-time at the private practice. And then a couple years later, about 3 years later, I became a partner in their practice. And right now we have a 5-doctor private group practice on Long Island. And I'm still at the VA half the week. And in 2006, as you mentioned, I became the residency program supervisor of our 4 residents at the VA. And that's what I do now. So about half my week is in private practice and about half my week is at the VA teaching.
Oh, that's cool. So you have a very mixed experience. You really get all sides of the profession, and it's cool because a lot of students are very into private practice, and the teaching aspect of stuff is like you're on the forefront of everything new going on. So that's cool.
Absolutely. There are actually about 10 areas of emphasis for optometric residencies. So, and I'll just list them quickly here. One's called family practice, which is primary care, and those are usually in urban settings. Okay. There's primary care optometry. There's cornea and contact lens, geriatric optometry, pediatric optometry, low vision rehab, vision therapy and rehabilitation, oc disease, refractive and ocular surgery, and community health. Probably one of the biggest reasons why people do residencies is that with how our profession has changed, to work in a hospital, to work on faculty at a college, pretty much residency is now a given. So, almost at the point where you need not apply if you don't have a residency. So if you ever see yourself working in those capacities in a hospital or a school setting, you definitely need a residency. More interesting and probably not as well understood by a lot of students is that even now, optometrists who graduate and work for ophthalmologists or who go work for private practice optometrists, in my position, I get phone calls all the time looking for verification that our past residents did indeed do a residency. So even ophthalmologists and optometrists who are hiring optometrists into their private practice are now looking for residency-trained optometrists.
Oh,
so
wow.
Not even just schools and hospitals, because people may say, I've never seen myself working in a hospital or a school, but now even to work in a private practice setting, it's becoming almost a prerequisite. So, so I think now that it's at that level, I think, it opens up a new consideration for, graduates. If you want to graduate after 4 years with an OD degree, do you want to graduate day one with doors already closed that you can't go here, you can't go there, you can't go there? So I think that's a major, major reason why people, who want certain practice settings would have to consider residency. The second reason why people do residencies is that they want to expand their scope of practice. So they want to learn something new, they want to become an expert, they want to make a niche for themselves. So that's where a lot of these residencies in things like low vision, vision therapy and head trauma, LASIK post-op, they have even surgical and cornea residencies, advanced contact lens fitting, pediatrics, all these areas. These are specialty areas that people feel they don't have enough experience in upon graduation. So the residency is a real concentrated experience where, I've read articles where they say it's like 1 year residency is like 5 years out in the field. It's an investment of your time. It's a lot of work. You have to present lectures and you have to write papers and you have to attend meetings. So there is an investment. Of course, financially, you are taking a hit. So, so a resident may make something on average of $36,000 a year compared to a friend who goes out into the workplace and maybe makes triple that year one. So there's also financial sacrifice. And, when you're in private practice, you have to set yourself aside from all the competition. So if you're doing something unique like head trauma or TBI or low vision, that's a specialty practice where you're going to get referrals because other people can't handle that. So that's where residency is very important too. That opens doors for you and just expands your scope of practice.
Quick, what are some of the things you teach? I know you said you teach over at Northport. What are a couple of the topics that you like to focus on?
Well, I do the ocular disease part. So my area of specialty is basically neuro and retina. So, so every Monday morning I give a 1-hour lecture to the residents. We do retinal normal anatomy, then we do all the retinal pathologies, and then we do normal brain anatomy, and then we do all the neuropathologies.
If students are thinking of doing a residency, what are the things that can help them to earn that spot?
I mean, as with most things in life, I don't think it's as simple as a recipe. We just, 2 weeks ago, we did our interviews for the residents who will be coming in July 1st. And in one day we had 10 interviews back to back. And there were 10 diverse people with very different backgrounds. And as I tell them when they come in for the interview, it's not like we just look at your NBEO scores and your GPA and rank it from there and that's it. We have some very strong applicants who are, on paper, extremely strong as far as GPA and the board scores go, but yet when you interview them or when you see what they're looking for, or clinically, may not be as strong. So, so I don't think grades, at least in our program, and I probably speak for a lot of programs, they're not the end-all. I'd rather have someone who's motivated, committed, active in the profession as far as our organizations go and going to meetings and things like that, because those are the people who are really going to change the profession, not people who have 4.0 GPA necessarily. And they could be one and the same, but not always.
Right.
So we really look for the whole package. People, if you're coming in for a vision therapy residency interview, well, then probably you should be a member of COVD, and you should be going to meetings in the vision therapy arena. Same thing with low vision, same thing with contact lens. We're looking for people who are really committed to those areas of expertise. So I think at some point in your optometric career as a student, you have to kind of start to think of where you may want to end up and make sure over the years that you're doing things that are going to get you there. But I think most importantly, it's people who are committed to the profession, who are committed to learning, who have goals in mind.
This is a question from student Eric Chow, and he would like to know what areas of residencies are currently developing, the most, and I guess, what's on the come up the most? Is it ocular disease or things like contact lens? And then also he wants to know which is the most popular that students apply to.
I think it really depends on the setting. Having experience with the VA, I can tell you probably about 5 years ago now, low vision was really put at the forefront, and lots of money was put in by the federal government to build low vision programs throughout the country at VAs that never had low vision programs. So low vision was very important to VA, and because of that, interest in low vision residencies went up, because now there was a market and they needed people who were trained in low vision. So, so at that point, low vision became very important as far as residencies went. Last year or two, because of the wars in Iraq and Afghanistan, TBI now is very, very important with the VA, and there's meetings all around the country, and all these VAs are opening up TBI clinics, again, that never had. They were traditional just oc disease clinics, and now the government says they have to open up these TBI clinics within, optometric TBI clinics. So now that's a very hot topic or a hot area of residency education within the VA system, just because of the demand, to residencies in general, is you have to make sure that it's a means to an end. So you have to see where you see yourself practicing. Even though you never know what life's going to present you with, you have to kind of see where you see yourself practicing and make sure the residency is something that's going to get you there. So I think it's important for students to remember, you may find an area of optometry, and it might be any area, not just ocular disease, but you might find an area of optometry very exciting, but you have to make sure that that's going to be a big part of your profession later on in your practice to make sure that the residency is worth it and you're going to the right residency. Last year, there were 320 residency positions for optometrists throughout the country. So there were 189 programs that had 320 positions. Last year, there were 1,400 optometrists that graduated with OD degrees. So you're talking about 300 and change positions for 1,400 graduates. So as of this time, there's just not enough residency positions out there to absorb all the graduates. So I don't think anytime soon, just based on logistics, residency education, for instance, can become a mandated requirement for our profession, just
Gotcha.
because we don't have enough physicians to put these people.
What can students expect to encounter, specifically clinical cases, at a residency like Northport VA?
Well, our residency, we're a very unique VA because we have a large rehab component. So our residents, how our program basically works, just to give you an example, because I can speak with knowledge of my program, obviously, is 4 hours a week we have lectures. So every Monday, Tuesday, Wednesday, and Thursday morning, we start the day with an 8 o'clock to 9 o'clock lecture. And Monday is me doing disease. Tuesday is another doctor doing head trauma and vestibular rehabilitation. Wednesday is practice management and equipment, so where they do, they go over VEPs and ERGs and fluoresceins and HRTs and things like that. And then on Thursdays is low vision lectures. So our low vision lectures, for instance, start with day one, how do you take a low vision case history, and then throughout the year you go through all the different equipment and how to do the exams and things like that. So you have a very strong didactic part. As far as the clinical part, our residents see about 1,300 patients over the course of the year. And the program, like I said, is in thirds. So the 1/3 is ocular disease primary care, where they're treating glaucoma, diabetic retinopathy, uveitis, all the inflammatory things. A lot of people are on systemic medications with possible ocular side effects, so we monitor for that. You know, we're constantly sending people for carotid Dopplers because of the plaques we find in the retinal vasculature. So that's 1/3 of it. The second third is low vision, where we have patients. We have a Victor's program, which is an intensive inpatient low vision program. The patients come for like 3 to 5 days and really work with our residents and with low vision therapists on how to use the devices and activities of daily living and things like that. And then the last part is our head trauma, where we do vision therapy, head trauma, and vestibular. Residents also have to write a paper, so they have to do some type of research and then write a paper for publication. They have to do 2 lectures. So it's we're affiliated with SUNY College of Optometry, so our residents go and they do a 20-minute minor presentation to their co-residents, and then they do a 50-minute major presentation that's open to the public. So there may be, you know, up to 100 people in the room when they give their 50-minute lecture on a topic. So it's an intense program.
Websites to look up residencies. Where can students get information besides from this interview? Do you have any good sites we could link up?
Yeah, one is called ASCO, which is the Association of Schools and Colleges of Optometry, and the website is opted.org. And basically, this has a description of every single residency program available in the country. Another resource would be the ACOE website. You know, the ACOE, like I said, every 7 years, every residency program has to be reaccredited. And it's a big thing. And if you lose your accreditation, it's really bad. So you always want to make sure you're going to an accredited program. So if you go to the ACOE website, which is theacoe.org, so it's THEACOE.org, that will give you a list of each program, its accreditation status. So you want to make sure it says accredited under status, and then it says, it also tells when the program will be reaccredited. So,
all right, so last question. Who should we interview next? It doesn't have to be about residencies or anything, but what would you like to hear if you were to, you know, tune in again?
One thing that I would like to know about, and I have to look into it really, is that one thing that's up and coming in our profession is fellowships. So 2 years ago, one of my residents who graduated from our program at Northport went on and did a 1-year fellowship at the Wilmer Eye Institute at Johns Hopkins, and it was a low vision fellowship. And I'm also seeing fellowships popping up in traumatic brain injury. So one thing I would like to know more about is these fellowships. What's its story with them, and where are we going with them, and you know, what are the benefits of them?
Okay, that is the conclusion of the OptometryStudents.com interview with Dr. McGovern of Northport VA on residencies. I encourage everyone to comment, and Dr. McGovern will hopefully get back to you and answer your questions. Thanks for listening. Bye.